Subcommittee to order, and if we could all rise and the chief could lead us in the pledge.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you as always, Chief. Appreciate that.
Thank you.
I didn't have time to do my hair this morning. I was just coming in from snow blowing, so forgive me. Do we have any public audience today? I don't see any. Maria, I didn't get any emails. Excellent. She's shaking her head. Boss says no. All right. Approval of minutes. Once again, Karen, an absolute wonderful job from our prior November 19th meeting. Any questions, comments, updates, concerns? Want to relive the magic? Excellent. We'll let those stand. I've been up since 3:30, so I'm well caffeinated. I apologize. All right, we'll go right to the meat of this. Farmington Valley Health District. I see Melissa.
I am here. Yes, sorry I can't be a more regular attendee these days. Been just a tad busy.
You got a little bit going on, I'm sure.
Just a little, yeah. So just kind of quickly, I'm sure you guys are all following the news and daily updates. So you know that vaccine is on the way. And in fact, the Pfizer vaccine has already arrived in Connecticut and is being predominantly administered by hospital systems throughout the state. So they are predominantly vaccinating all of their staff within the hospital system. They're also tasked with providing vaccines to first responder organizations. So some of you guys might have received some, we'll call it confusing language and messaging coming out from the state regarding who actually is eligible to receive vaccine and when and where, and sort of the process on how to register. So we apologize that there's been this kind of back and forth between, do we register with the local health department, so us, or with some unknown entity or hospital system that might be providing this vaccine. So what I'll say is we're anticipating today the FDA is going to be meeting on the Moderna vaccine, which is the one that local health departments will be primarily using to provide vaccinations with. And so, as you know, there's multiple phases of the vaccination campaign. So depending on who you talk to, either within the state's own phase or the Fed's phase. It varies between 3 to 4 different phases of operation. So we're currently entering into phase 1, and that one actually has 3 subgroups. And so there's a lot of different priority groups that need to be vaccinated first. All of our local health, all of our, again, healthcare workers across the spectrum, first responders. It primarily right now, at least within the phase 1A, is going to be those with medical responsibilities. Obviously EMS, paramedics, and then fire, police that have medical response requirements as part of their jobs. So we're currently working through obtaining employee rosters, and so notification was sent out yesterday. You probably saw it from Jennifer, to our first responder organizations, asking if you have not already submitted your employee rosters of those individuals who are eligible to receive vaccine now and want to receive vaccine, to put that information together. We provided a spreadsheet that has to be uploaded into this electronic system called VAMS, which is this Vaccine Administration Management System. It's how everybody is going to be able to ultimately schedule for the clinics that they want. You'll get some second dose reminders because this vaccine does require 2 doses separated at 28 days. And so in order to be fully protected, you must receive that second dose, and it needs to be the same as the first dose, so the same manufacturer. You'll also have to complete a whole bunch of paperwork electronically through this system. So once we get that information and we upload it into the system, your employees will receive an email inviting them to create a profile on this VAM system. And, and like I said, it'll go through the different steps on how to schedule for vaccination. We, at this point, so the FDA, as I said, is going to be meeting today to talk about authorizing the vaccine under what's known as an emergency use authorization. So that just means that it's not, the vaccine is not, has not gone through the full approval process like other medications would, or medical devices would. And so they recognize that while they don't have all of the scientific data and research to back it up, the benefits outweigh the risks associated with it. And so this has happened before, it's not necessarily an uncommon thing, but there's still the unknown questions, well, we have questions and unknown answers, I should rephrase that, to elements of the vaccine, specifically surrounding the vaccine has not been studied in pregnant women, lactating women. There's been no pediatric studies under the age of 16 with these medications, and limited studies in the elderly populations, and also some with, comorbidities or medical problems that could cause more serious disease if they get infected with COVID. So there's still a lot of things and a lot more studies that have to be conducted. But as we know, it feels like we've been in this pandemic forever, but in reality, it's been 10 months. And so there's still a lot unknown about the virus. We don't know what our natural immunity to it is still. We think that if you get infected with it, you're probably going to have some immunity for approximately 3 months. There have been studies and reports of individuals getting reinfected a second time with the virus, and they've confirmed that it's not just an infection that's just, prolonged duration. And so we're still a little bit unclear, on the vaccine front, how long immunity will last once you get vaccinated. And so, is it still possible that you could come down and get sick with COVID even after vaccination? Yes, that theoretically is possible. So again, as I said, still a lot of questions, but the vaccines are safe. They are, early studies are showing that it's 95% effective at preventing illness. And the vaccines themselves are made using a newer technology that actually does not utilize any part of the virus to make the vaccine, which is very unique. And so they think that it's, going to be a little bit more of an effective vaccine and hopefully decrease, the potential side effects in, other possibilities of coming down with other adverse events. So time will tell, but, as long as if FDA approves the vaccine this week, either today or tomorrow, there's an advisory committee on immunization practices. It's a federal organization that oversees and provides these priority groups ultimately on who should be receiving the vaccine first. And so they will meet on Saturday to determine and finalize the priority groups for this specific vaccine, the Moderna vaccine. And then it will be shipped beginning possibly this weekend or on Monday. And so we're getting ready and to receive the vaccine anywhere between Monday and Wednesday next week. We are actively working through some technologic difficulties in accessing this VAM system that I mentioned before. We're having some issues with that. So until we can get that resolved, we actually can't go in and upload those rosters and start scheduling clinics for folks. So we're working really hard with DPH, the State Health Department, on remedying that issue, and hope to get things up and running by the end of this week. So we'll keep you posted. Stay tuned for information coming out from us. And in terms of the clinics that we'll be offering, we're going to be working specifically with the Farmington Valley VNA. So I see Nancy on the call today. So we're incredibly appreciative of their support, for all of this. The health district, I'm the only licensed nurse there, and so I can't do it all. So, and I work for 2 health departments, so I really can't do it all. And so it's really valuable for us to have a great partner like Nancy's team to help us. And so we've done a couple of drive-through flu clinics earlier on in this flu season, and we used their team, and it was just like a well-oiled machine. Everything worked fantastic. The sites that we chose, including the Simsbury the Weetawt Fire Station, worked perfectly. So, certainly very appreciative of all of our partners, police, fire, EMS. And so we just ask, for continued flexibility, for fast turnaround times when we put out, prompt requests. And so, I have no issues or no concerns at all about your speeds. So again, we appreciate it. And we'll certainly share more information as things progress and we actually get vaccine in hand. So
Melissa, appreciate that.
Questions.
Very thoughtful update. Just a quick one, and don't want to go too deep, but any additional security needs as a result of the vaccine on site? Otherwise, it would need to be coordinated with the police department?
Yeah, sure. That's actually a great question. So from a federal perspective, they are not indicating that any real definitive requirements would be in place in terms of, having a security escort to and from clinic locations. It's a little bit different. This process is a little different than our normal mass prophylaxis planning where, with specifically like an anthrax event, security was, very, very tight. That being said, though, I will say that we are taking every precaution possible. So obviously the vaccine is going to be stored in our office in a locked refrigerator. Our office is obviously fully locked. We have an alarm system. We've asked the Canton PD to step up routine patrols around our building just because there's no security cameras in the back. And we have had several years ago, our trailer that houses our preparedness equipment actually was broken into and our generator was stolen out of that. And so we've asked them to step up patrols regarding that. And in terms of PD support at our clinics, I would like, and it's my intention that for all of the clinics that we do that might serve, broader populations, not talking about our first responder groups or the more small targeted, stealth-like clinics, but the bigger ones, I would ask that there is police presence on site to help not only with traffic management, if that's an issue, but also just general security of the premise, and making sure that nobody's unruly. I don't think that the general demand for this vaccine is very high. That may change based on, the rollout and how well people perceive it is working. So, that, like I said, it's somewhat fluid.
Okay. Just, didn't want to get too deep there. And then the other question from the gallery, any updates on the local numbers the last 2 weeks?
Shoot, I should have pulled that up for you. Sorry, let me grab.
If you don't have it, that's okay. Just send it.
I have it, so I can share it.
There you go.
Yeah.
Great,
Teamwork.
thank you.
All right, we can do that as part of Maria's. Any more questions for Melissa? Because I know you've got a lot going on, so you probably want to get going.
No, I'll stick around for
Oh,
a
you're
little
good?
bit. So, yeah.
Okay.
If anything else comes up, I'll be here.
I do have a question. This is Karen from the ambulance.
Sure.
Hi, Melissa. How are you?
Good, and you?
Good. Hanging in there.
Yeah.
Just wanted to double check that we submitted all of our information for our volunteers and employees through our med control, I believe, as well as the fire department and the police department. Is that going to be enough for the VAMS program for us?
Yeah, so you should be receiving, once that information is uploaded, and it's obviously up to the hospital. So it must have gone through St. Francis, right? Because that's who your med control is.
Correct. And I did get the confirmation as the employer. My concern is that we're going to have people going out there and registering to get the shot done all at once.
Right. Yeah. So
Yeah.
we're actually recommending, and thanks for reminding me. So we are recommending that as your employees are wishing to get vaccinated and these clinics become more frequent, that you consider staggering your employees who get vaccinated. So maybe do, around 50% 1 week, or, you can determine the percentage that you want to use, but we just feel that based on the information that's available, there are side effects due to the vaccine. They're not serious. A lot of it is just based on your immune system responding to it, which is what you want. But some people can develop chills and fever and, just general feeling kind of yucky for a couple of days. And so some people might not go to work because of those symptoms following vaccination. And so we just don't want to decimate your entire staff by vaccinating everybody all at the same time.
Exactly.
Yeah, so that's
Yeah,
definitely a recommendation. And, in terms of the VAM system, once you're registered as a user, that individual has the opportunity to choose what clinic they want to go to. So there's going to actually be like a vaccine finder search bar, if you will, within the system. So you put in your radius, your zip code, and it'll populate all of the available clinics in your area. So it's possible that you could, register and thinking you're going to get vaccinated at the hospital or by the hospital, but maybe we have vaccine at that point and are ready to start providing vaccines to our priority groups. And so you might see one of ours pop up. So they have options. And so, controlling that is a little difficult just because it's up to the employee at that time to choose where they want to go, not so much the employer.
Right. Understood. Okay. I know it's very fluid and we're still working on this. And I just want to reiterate too, as well as with the VNA, we're willing to help in whatever capacity we can in terms of physical location. Just let us know what we can do to help out.
Without a doubt. And I could talk for hours about this stuff. So in addition to PD, we would like EMS present at our clinics, especially the larger ones, because everybody has to be monitored for a minimum of 15 to 30 minutes after vaccination, depending on your medical history and any allergy histories that you might have. And again, it's a novel vaccine. We've never seen this, so we just don't know what to fully expect. And so we want to ensure, everybody's safety on site. And so we would definitely be looking to EMS to help support that effort. In addition, you probably have also seen and heard that the governor and the Commissioner of Public Health have written some executive orders expanding the possible vaccinators to include paramedics, EMTs that have experience giving IM injections, so intramuscular injections, podiatrists, dentists, hygienists, vets. So they've greatly expanded the pool of people that we have access to help us in this endeavor. So that we're not, maybe having to burn out Nancy's staff all the time by doing like a zillion clinics. And so we've got more folks available to us. So Karen, I know I've spoken or at least emailed with you before about the possibility of utilizing some of your available staff in that effort. And there are going to be specific required trainings for that expanded group. So keep an eye on the state's website for that, Karen, for those trainings for your staff. And then we'll keep you posted.
Yep, absolutely. We'll do. All right. Thank you.
Thanks.
And Chris, you and I as elected officials, we get to go to the vet for our vaccine when it comes out. So, all right.
Yes. Hopefully one that doesn't, and we'll probably end up with one that doesn't have any certification or lost theirs years ago too.
It'll be fine. It'll be fine. All right. Other questions for Melissa? Obviously a ton we could get into here, but I think a really good update on the front of mind topics.
Just one question for Melissa. Since there is a 15-minute watch period after giving the vaccination, this is kind of eliminating the drive-through possibility on this, isn't it?
Not necessarily. I think we just have to be a little more creative. So as individuals register for these appointments, we're able to select how long their appointment will be. So not only, they can't just show up on site. They have to be registered. And so we can control how long these appointments last. In most cases, I'll say there's some caveats that I won't get into, but I think we can talk offline, but I do think that there are some possibilities, but all of this greatly reduces the total number of our throughput and the total number of people that can be vaccinated within a given time. And so we just have to be patient that this is going to be a very long duration vaccine campaign. Just getting through phase 1, not even, all the 3 different subgroups within phase 1 could take months. And that's just one small section of our population. That's probably for our towns, for FEHD's towns, we're looking at just a couple thousand people that fit into that, which could literally just take months to do. So it's going to be a while before we're ready to increase vaccine to the general population. So Mike, we'll talk.
Okay, thank you.
Thank you. Sorry about that. I've got my little snow day sidekick here with me today. All right. Town manager's office, Maria.
Great. Good morning. Thank you. I also have a sidekick this morning with a snow day. So we'll see if she happens to pop up and say hello. But good morning, everyone. And for those of you that did hear my town manager's report just on Monday evening, I do have some information that I had shared a few days ago, but do think it's helpful just to go over it in this particular setting. So I'm happy to share some of our most recent statistics regarding the virus. We have transitioned to the red status in terms of the Department of Public Health's municipal COVID alert system, which is the most severe on their scale of the alert status. So the red status means that we currently have 15 or more cases per 100,000 people. And this data is for the most recent 2-week period that had actually ended back on December 5th. We currently have 23.7 cases per 100,000 people. And our positivity rate was 4.2% amongst those individuals being tested. We had 83 cases over that most recent 2-week period, and we do continue to monitor this. In general, our workforce is largely remaining healthy. However, during the month of November, we had a large number of staff members, actually it was 19 staff members, that were quarantined due to coming into contact with a person that had tested positive for the virus. A small number of those folks were quarantined from coming into contact with a person at work, but a majority of them, it was outside of the work setting. And then from mid-November to December 1st, we had an additional 4 staff members with positive cases. So as a result, at times we are finding that we have some temporary staffing shortages, and our response time for non-emergency situations may be delayed. And we just ask our residents and our patrons for continued patience and understanding as we work through this difficult time. And I do really want to thank my staff. I think that they are doing a really good job of trying to engage in safe practices at work, just to ensure that our critical infrastructure and services remain operational during this period. I think a really good example of that is the storm response that we're seeing right now today, and public works and parks and the staff at the schools, they're out there and they're getting our roads and parking lots clear. So they're just doing a great job under very difficult circumstances. We are continuing to welcome walk-in visitors to Town Hall and the library. It is still limited hours. Town Hall, we're doing Monday, Wednesday, Friday mornings, and the library is doing Tuesday, Thursday, Saturdays, sort of late morning into the afternoon. Curbside pickup is still available at the library on the days they're not open for walk-in visitors, and they're also still doing technology appointments. Something I wanted to share, we've gotten some questions about our walk-in hours and why Town Hall might not be open more days during the week, or why the library might not be open more days during the week. And, one of the reasons, just from a logistical perspective, is our facilities team is a really small staff. And when we are open to the public, we want to make sure that we are adhering to vigorous cleaning protocols and that we are adhering to essentially sector rules regarding cleaning commonly touched surfaces and things of that nature. And so the way that we're tackling that is by alternating days that we're open to the public. And again, that's also helping us do our best to try and remain within budget despite having additional pandemic expenses that we're incurring. I really do want to thank our facilities team. They have just been working so hard. They're sort of our unsung heroes. They don't get a lot of credit for the good work that they're doing right now. And I want to make sure that we thank and acknowledge them this morning. We have reiterated with staff for our staff members that are largely administrative and their primary work locations are indoors. We are really doing our best to try and keep working in pods, essentially. So any one department in that situation trying to be at about 50% capacity at any given time. And what we're really doing is trying to preserve the workforce, again, to make sure that there's a continuity of services in the event that we have a member of a department or multiple members of a department that become ill. And an example of this is there was a neighboring town not too long ago where they weren't using sort of this platoon or pod concept, and an entire department did either in combination become sick or get quarantined, and they had to shut the entire department down for 2 weeks. And again, we're providing critical services. And so again, this scheduling has seemed to help us shield us from any shutdown of that nature. And we've been able to keep moving forward, which I think is very important. So we have, again, most of our park and other facilities are open to some extent. I did want to highlight quickly, though, today that the ice rink, which is now open for the season, we have had regularly changing guidance from the state on that over the last few weeks. And I want to thank the public for their patience with us. We have had gathering sizes on the rink change. And unfortunately, with the most recent guidance that came out, we're having to drastically limit the number of skaters on a sheet of ice at any given time. So we have unfortunately had to cancel some of our group skating lessons, as well as some of our rink rentals. We are continuing to monitor that, and our Culture, Parks, and Recreation Director and his professional association are still trying to work with the state around guidelines for ice rinks.
Maria, just to go quickly, and I know that not necessarily a huge topic for everybody here, but because we brought it up, it's 4 people on the ice, correct?
That's our understanding, right? The guidance that we had received is that 4 people on the ice at a time, which is a relatively small number when you think about how large a sheet of ice is. Yet, for example, in contrast, they're telling us that indoor roller skating rinks can be at 50% capacity, and that our outdoor ice rink can only have 4 skaters on it. So we do think that the outdoor nature of our rink too provides some advantages, and again, it's just very odd guidance. And so we're continuing to work with state officials to try to perhaps have some guidance there that's a little more practical.
Yeah, and I don't want to go deep, and this is not meant as a shot at anybody, but there has seemed to be appointed personnel at the state level interpretation that's continuing to happen in the restaurant industry with regulations of alcohol and beverages and such, skating rinks, et cetera. And at some, I know it's all in the vein of safety, but it all needs to be based in science and coordinated. So if there's anything we can do to get to our legislative leaders or others, we should probably try to coordinate that. And again, if 4 is the right number from a scientific standpoint, that's fine. But then I would wonder why other establishments can have 20 that are indoors. So it's just not lining up, and it causes frustration for the public, and then it causes people to ignore the guidance overall when it is meant for their safety, because things like that just don't add up in people's heads. So we need to try to do what we can to yell upwards and get some coordination out of that.
Yeah, definitely.
So
Thank you.
I know nobody here has done any of that, but again, you're all the ones that are getting yelled at or hearing about all these conflicting messages, et cetera. So
great. Thanks, Sean.
Yep.
So our senior center will remain closed until further notice, and we are back to having rather limited services. And during Kristen's report, I'll let her elaborate on that. We continue to distribute information about the travel advisory approximately weekly. And we're trying to, again, just help people understand what states have been added to the list, removed from the list, reminding people about the form if they do in fact travel that they're required to complete for the state. And we are screening our patrons when they come to town hall for the travel advisory. Just a quick FYI that the Board of Selectmen recently extended our temporary suspension of cash payments until further notice. Most recently, we had done that through January 1st, but since the pandemic has continued, they agreed to do that, and that has been helpful so far. Meetings will continue to be held virtually until further notice. And then in some cases, for example, with our snow day today, that's actually been really helpful. So, in the past, when we would have a major storm event like this, we would be canceling our public meetings and having to reschedule, having to actually shut down our public facilities. Prior to the pandemic, outside of the department head team, most of our staff members didn't have the capability to work remotely. So I guess that's one positive that's come from the pandemic, is that even though we're experiencing a storm event, staff members are still able to help provide services, albeit remotely today. And
I
that's
would
what
argue that's not a positive because we don't get to play. We don't get to play in the snow anymore. But
that's true.
I am thankful that the school let the kids play in the snow today. I think that was a thoughtful decision from their standpoint.
That's great. Agreed. And that's all I have for this morning.
Maria, thank you for that.
You're welcome.
Questions for the town manager? All right. Michael Barry, emergency management, my friend. I'm sure you've got a lot going on.
Good morning.
Morning.
So this morning is going to be another short one because the emergency management is continuing to be in a holding pattern. As you heard from Melissa, we are kind of waiting to see how everything is going to shake out with the vaccines. And we're going to be working with them on being able to distribute the vaccines to the proper personnel in order that comes down from Department of Public Health in the state. We're on weekly state conference calls and DPH conference calls, trying to keep up with the latest information and trying to decipher the encrypted messages they're sending about who's going to get vaccinated and when. And we will make sure that we keep everybody advised of that as we know. WSIM is continuing to pump out information, and we will be reading that information for the first of the year to make sure it's fresh and keep everybody entertained. The first major snowfall has happened, and I think we've done a fantastic job keeping up with it, and with the cooperation of the public, they were able to keep off the roads as much. I didn't see much traffic out there, which was good. For power outages, we've been in contact with Eversource, been in contact with them overnight, and we had one outage, I guess, and it's just been rectified within the last 5 minutes. It disappeared off the map. So it looks like we're back to full power within the town. And we keep up with the weekly incident action plans for our COVID situation for prevention and making sure everybody is on top of that. And with that, that is my report for this month.
Mike, appreciate that. Questions for emergency management? All right. Chief Bolter, police.
Hi, good morning, everybody. We continue to have a small number of employees that are affected by either directly or indirectly by COVID. One of our officers had been hospitalized for just over a week, but has been released and is now recovering. So we are grateful for that. For storm-related information, for the most part, the conditions, the roads were passable thanks to a great job by the Public Works Department and people staying off of the roads. We certainly appreciate Public Works being there, not just for us getting around through the roads, but they're always there for those emergencies if we have to get to driveways, and they're always around. So thank you to them. Another great job. I had the opportunity to travel to a couple different towns, and some coworkers and I did this morning, and just realized the level of service that we have here is not always comparable to others. Just a real brief on our Stuffer Cruiser event that we had last week. Thank you to everybody who was able to come out and donate or participate in that. It was probably one of our best years ever. Extremely generous community this year, and not just in Simsbury, but in surrounding communities coming to our event to donate toys for kids. So we had that up at Neckar's this year. And some of the items were brought here locally for members that were identified, or for residents that were identified by the Chamber of Commerce that were in need. And then others were brought to the Salvation Army for distribution there. Our pink cruiser is back to the normal color scheme. As you recall, it was pink for the month of October for breast cancer awareness, for November for the No Shave November, just general awareness for cancer, and then also for PJ Day, which was December 11th. And again, a big thank you for all those who helped and donated or participated or spread the word on that. And then just one last comment on the communication among this group. Everything from our snowstorms to other preparations to COVID, it just has been tremendous, and we really appreciate it. And just wanted to thank everybody for that. That's all I have.
Get that, Chief. Thank you. Any questions for the Chief? Deputy Chief Davis, anything to add there?
Nope, other than I just want to just agree with the chief on, coming in this morning, it was pretty amazing to see the differences in different town services in the road conditions. Simsbury was by and far the fantastic, and I said the level of service that's been provided has been fantastic, as well as like the chief just mentioned, the communication, leading up to the storm and everything going on with it has been extremely impressive. So thank you all for
Excellent.
that.
Thank you, sir. All right, we'll move on to ambulance.
Yeah,
Karen
good morning,
Stewart.
everybody. I'm here. So my goal next year is to have a pink ambulance. I just want to say a completely pink one. That would be perfect. So we continue to remain well staffed. We had one employee that tested positive who has to return to work. We continue to maintain an adequate PPE supply, and would like to thank the Simsbury Fire for making the trip yesterday to pick up the state supply of PPE. I'm sorry it isn't what the fire department expected. I guess the numbers were a little bit confusing there, but since it's all boxed up in cases, we ask the PD and fire to just let us know what they need as we continue to just stockpile it up in our training room. If anyone needs any gowns, I can assure you we have enough for the entire town to wear a gown every day, probably for the next year. We've been sharing our KN95s with Sarah for the local businesses, and we have registered with St. Francis Hospital for vaccinations, and will be available to help the health district and the VNA with the distribution of vaccine. So we're ready to go with whatever we can do to help out. And that's the essence of my report. Any questions for anybody?
Appreciate that, Karen. Thank you. Any questions, guys? Okay. All right, move on to fire. Chief Baldus.
Hi, good morning. Everything seems to be fairly quiet. We had one incident overnight, a little electrical issue with some trees on power lines, and over actually in your neighborhood there, Sean.
I was gonna say I saw the letter leaving this morning, and I was gonna ask about that. So yeah.
Yep. So unfortunately, nothing too serious, and Eversource was on it. And as Mike reported, sounds like the power outage that was part of that call has been taken care of. So that's always good news. We continue to remain COVID free at this time. We've had a few exposure scares, but no in-house infections or anything that is spread in-house. So things remain in good shape there. We have submitted our information for the vaccine for all of our EMR and EMT first responders. And just to give you an update, while we've been on this meeting, I actually received my CDC appointment request. So I was actually able to go on during Maria's report. Maria did listen. I was able to multitask here, but was able to actually register, and I'll be actually getting a vaccination on Monday. So the process is working, and it's actually coming out. So I'm assuming we'll be hearing more from the first responding groups very quickly here. We'll then wait, obviously, for the next phase, which is going to be our non-medical first responders for the rest of the fire department to be able to get their vaccine shots. Beyond that, we have had one situation that we see cropped up over the past month or so, a little different than in the past, and that's lost persons actually over in the Iron Horse Boulevard area between Iron Horse Boulevard and the river. We've had a couple of lost parties that we've had to go hunt down and find and bring them back out. So we are definitely seeing a little bit more activity going on with people getting into areas that they typically have not been venturing into. The overgrowth in that area, I think, tends to create a little bit of confusion. And thankfully, with the cooperation of the police department, along with our membership, using the UTV and other means, we've been able to get, the people out safely with no issues there. And on that same track, we have also ordered and are expecting literally any day now, basically snow tracks, if you will, for our UTV. The UTV that we have that we use for mountain rescues and so forth is great, except in heavy snow. In heavy snow, those tires just don't really grasp the snow. So we're actually going to be swapping the tires out for actual tracks, and that'll allow us to basically have that vehicle available to us year round, and especially during the winter months. And we do expect, obviously, with more and more outdoor activity among our residents with the COVID and trying to maintain distancing, that we expect that there'll probably be a little bit more activity outside. So we'll be prepared to able to respond to those situations. And like I said, that'll be happening very soon. And on a final note, I just want to publicly thank the police department in particular, but also ambulance and public work for their support of the Simsbury Celebrates parade, torchlight parade that the fire company put on. As everybody knows, this year was different. Instead of marching down the street, we had the town march by us, if you will, in their vehicles. And there was an overwhelming success with over 1,000 cars. It was actually greater than we anticipated. A 2-hour event was extended to 3 hours to ensure that anybody who wanted to see the decorated apparatus would have an opportunity to do so. We had obviously the ambulance was there, decorated out. The Public Works this year was the first time that they put a decorated piece of equipment in the standing parade, which was great, and we thanked them for that. But like I said, most importantly was the cooperation with the PD because the traffic, the traffic on coming into Iron Horse Boulevard off of Owens Brook was the entire length of Owens Brook and down Firetown Road for about a mile. And the police did just a great job handling that impact because, like I said, it was an overwhelming success. And we just want to shout out a big thank you for their support. So that's my report for today.
I agree. Thank you for all that, because it was a bright spot in everything that's going on for the kids. So good stuff. Questions for the chief? Am I going to see you out there in a Santa hat on the new with the new snow tracks?
You just never know, Sean. You never know.
I figured with Kowalski retiring, we'd see the snowmobiles up north, but okay. All right. Board of Education. Neil, never a dull moment in your world, my friend.
No, sir, not at all. I'm glad we were able to give you, some of you, some sidekicks this morning and some time to play in the snow with our official snow day today. And while some of my colleagues may have gotten to sleep in today, I want to thank you for holding an 8 a.m. Public Safety Committee meeting so I could maintain my normal level of productivity.
We do our best. You can thank Maria because it used to be 7, right? But she talked me out of that. So
I would report that we are doing okay right now. We're certainly looking forward to vacation, but since this group last got together, as probably from our communications that go out, there has clearly been an uptick in cases, not surprisingly, in the past month, and many of those cases need to be contact traced in the schools. Not all of them, depending on the onset of symptoms or the timing of when people were tested. Sometimes the incubation period allows us to not have to contact trace it in school, but many do. And certainly we've put a lot of resources in the last month into contact tracing cases. Our administrators, our school nurses, just lots of people involved. I will note that what we think is a pretty effective redeployment of a scope of a job, that the administrator that we have redeployed to help with contact tracing is our athletic director, Jeff Pinney. With no athletics going on, we had an administrator who obviously had some time and some ability to go and assist others. And we taught him how to contact trace, and he's our first person on the scene now to assist others in that process. And you know, a good use of the school system's resources during a trying time. What I will say with the cases that we have had, we continue to be able to say that they are isolated cases. So while COVID-19 is coming into the school, we still have no evidence that it is spreading from student to student or from student to teachers. We're able to effectively contact trace it, quarantine the people who need to be quarantined, and keep it from spreading from person to person in the schools. So we've been very effective at that, even where there have been cases. The school that seems to have had the most impact right now, especially last week, was Squadron Line School. Quite frankly, that was actually not student cases, but employee cases that which are actually a little trickier to contact trace when an employee has a diagnosis. So we came close in terms of staffing shortages at Squadron Line, but we're able to make it through. So right now, staffing shortages, we're making it through, and we certainly hope that the break here will allow us to sort of recover and be able to come back at the beginning of the new year in full force. So what we are seeing, while it's not spreading within school, we're seeing more cases where multiple members of a family who attend multiple schools are experiencing COVID within their family unit. And so, each of the cases is treated separately, but that's definitely been a trend in the last month where 3 members of a family will be testing positive. So as probably most of you know, we'll be in school tomorrow, but then for the 3 days of school next week, the 21st, 22nd, and 23rd, we will be doing remote learning. And as a result of that decision, we will be able to not have in-person contact really between December 18th and January 4th. So our hope being that that helps with the, bend the curve, if you will, as it needs to happen in the general public, that our case counts will certainly come down, and we can hit the new year with less contact tracing to do and less quarantining to do, because that is challenging. I will note, Chris Peterson asked the last time that we had when younger kids, elementary school kids, were quarantining, at that point we did not have them working remotely. We have changed that policy so that kids who are in quarantine are able to connect with their class, and that's been a positive change. So thank Chris for mentioning that and for pushing us a little bit on that front. So I'll stop there and see what questions people might have.
Thank you, Neil. Appreciate all that. And as a parent and a member of this body, I continue to be impressed by the communication from you and the superintendent and the principals, which is the clear, quick, concise, here's what happened, here's what we did, here's who needs to worry about it, and here who doesn't. And I think, again, we all have social media presence and grocery store conversations. And the one thing that I don't hear is any concern with how the school and the health districts had handled anything in school. The only questions I get is folks not understanding what you just reiterated again, that the kids aren't giving it to each other. Best the science is telling us at this point. So every chance I get, I'm reiterating that message, that's what I hear from the experts here. And that seems to put both my peers, friends, teacher friends at ease when they continue to hear that. So I appreciate you guys continuing to hammer that message. Questions for Neil? All right. Neil, go make a snowman, my friend.
Thank you.
Public Works, Mr. Roy, you've been up all night, I'm sure. How are you?
I'm feeling good, all things considered. Appreciate everybody's kind words on the roads. You know, as we've talked about in the past, the crews do all the work, and they take a tremendous amount of pride in what they do, and I think that really is a big key to why we're able to do what we do. Right now, it looks like we're still going to get another inch or two, hopefully closer to the inch before noontime, when this thing should be fading away. It's going to be about 5 or 6 hours after the storm ends before we're going to be able to get the guys home, just because they have to push back all of the roads, essentially 2 passes down all of the roads. Last night, at certain points, it was absolute whiteout conditions. It was a tough storm. The nice thing for us is those intense bands did not last as long as they had originally predicted. So I think we're going to end up with somewhat on the lower end of some of the snow totals they had talked about. We are going to be keeping an eye on the wind today, both from a drifting and blowing standpoint, and also for the potential of power outages associated with any tree limbs. One interesting thing, we didn't get a full rest break last night, but we did get the guys in for about 2.5 hours, and we actually used tents to keep them separated while they rested. Just small individual 8x8 tents, but it was kind of a creative solution to kind of help keep everybody safe as we're trying to stay separated during these difficult times. So, and also, you know, as always, it's a teamwork. I appreciate last night the PD helped us with a couple of cars that were parked on the road, getting them out of there so that, one, we don't damage the cars, and also that we can do our job. The one message that we can't say enough is residents can help us by not plowing or allowing their contractors to plow snow into the roads. At the end of the storm, we're going to put down salt. If somebody takes a pickup truck and plows across the road, it's like taking a wet sponge and wiping all that salt away, which means we're going to be back tonight for icing situations. The silly one, but I saw it this morning, people snow blowing into the road. Again, it just causes the whole process to take longer. And again, we realized we put snow in your driveway. We did it because we had no choice. We're trying to work with you. Moving away from snow, just in general, as Maria pointed out, our custodial department is cleaning and disinfecting the building 4 times a day. We're all working on remaining socially distanced. And finally, since Chief Baldwin brought it up, we were very happy and very appreciative of the fact that he invited us to participate in Simsbury Celebrates. I think it really meant a lot to our crew to be in viewed in that respect as first responders. So
I appreciate that. Any questions for Mr. Roy? All right, go get yourself another coffee, my friend. Social services, Kristen.
Good morning. Are you able to hear me?
We are, yep.
Okay, thank you. We are hanging in there. My staff has been working very hard, continuing with our food programs. Our last 2 cheese days have been some of our largest ones. And we've also been extremely grateful for the contributions from the community. We've had some really amazing donations, and our folks that are on the food programs have gotten a lot of additional assistance from the community. So I really appreciate that. Lots of individuals and businesses just really stepping up to help everybody. And that's been heartwarming. And right now we are wrapping up our holiday program. We, again, have had a tremendous outpouring from the community for our holiday program. This year, we are only working with gift cards due to COVID restrictions, and everybody has been very understanding and supporting, and tremendous donations from the community. So I really want to thank everyone. We thank everybody individually. and my staff is also working on our energy assistance program. You've heard me share it's a little bit different this year because everything is being done virtually. So it's a little bit more challenging for ourselves and for our clients, but we are getting through it and helping to make sure everybody gets their assistance so that they can stay warm this winter. We are still offering the hand-sewn masks. We are taking a break from producing them because we have more than ample supply on hand. But as you've heard me share, if anybody needs those, we still are making them available. Is continuing to be closed to the public, as Maria shared. Our official guidance from the health district, and which is also being mirrored in the surrounding towns, is that senior centers should still remain closed to our seniors because they are, our most vulnerable citizens. We are no longer offering any in-person health services due to that guidance as well. We are continuing with daily Zoom classes for our seniors. We have opportunities throughout the day for fitness and socialization. We've done arts and crafts and many other social and entertaining opportunities. So we're trying to keep up and keep everybody from being isolated as much as we can at home. That's all that I have. And if anybody has any questions, I'd be happy to answer. Thank you.
Thanks, Kristen. Appreciate that. Any questions for Kristen? Okay. Normally I would go to Nancy, but she's got a Yankees hat on, so I don't know if I can. I don't know if I can actually go to this agenda item.
Oh, now come on, be nice to me. It was like 2 minutes to 8, and I was like, oh my God, I have a meeting. I haven't even brushed my hair. So sorry, but this is the best that I could do.
That's the worst you could do. You could have picked anything else, my friend.
At ease, at ease.
All right, go ahead.
Boy. Listen, I'm going to be the one that gives you your flu shot or your vaccination. So you be nice to me.
I know. Now my arm's going to hurt for a week.
It could very well. So from the VNA perspective, I'm just really happy to report because we're everywhere and we do have COVID positive patients. We do not have COVID positive staff. So I'm really fortunate. We're doing what we need to do and things are working out really well. We are ready to partner with the health district. I'm so grateful for that partnership. So we are ready to go as soon as the vaccines are ready to go. And I'm grateful, just as an aside, because we are healthcare providers. We are in that first distribution of who should receive a vaccine. But if it weren't for the Farmington Valley Health District, my staff wouldn't have it available to them for quite some time. Even though hospitals are supposed to roll out to us, we haven't gotten any word from anybody. So I am grateful for that partnership on a lot of levels. And I do look forward to working with ambulance, especially because our initial clinics will probably be at our agency. And while we do carry epinephrine and we do have the capacity to monitor people, it's nice to know that EMS is right in our parking lot. So we will be looking forward to working with everybody to make this happen. And we know it's going to be a long haul. I do want to just commend the Board of Education because honestly, the fact that you guys have created an environment where there is no spread is remarkable. Despite every protocol in every healthcare facility that I have been in or that I have worked for, even when everybody's doing what they need to do, the spread is still continuing. And the fact that you are making that not happen in a school system is remarkable. And I will just share, like Karen did, we were a part of the DPH distribution yesterday. Just to let you know, the amount of PPE that we received as a little tiny VNA, we got 22,000 surgical grade masks yesterday. So honestly, if any of you and or your employees or your staff, you need some more of that sort of thing, please reach out to us because we really do have enough to distribute to some of you. Cloth masks are great, but surgical masks are better. And while we are all wearing our fit test masks when we go into clinical situations, when you're running in and out of a store, a surgical mask is better to use than cloth. So if any of you would like some more of that, please let me know. Otherwise, I think that's it.
Appreciate that, Nancy. Thank you. All right, questions for Nancy? All right. Do we have Sarah this morning for Main Street? Didn't see her. Okay.
No, Sean, I'm sorry, just quickly, did you
oh.
see the email from Sarah? She had sent an update that she was hoping you could read. If not, let me see if I can pull that up and send it to you again, just quickly.
Is that the one that, yeah, I got something yesterday. She said it didn't go through the first time.
Yeah, let me see if I can pull that up quickly for you.
She sent you an email that she was continuing to work with all the businesses. She updated everybody about Abigail's being closed, that they were working together, that they had a positive case, so they are still quarantined for a number of days. Trying to think, because I read the email, she was hoping that you would update everyone, but it sounded like they were just continuing to work together to help businesses, continue to follow protocols.
Okay. Yeah, I'm not seeing it. There's for some reason, my town email will bounce back sometimes, folks. We've had that happen. All right.
Yeah, Nancy did a good job. Thank you, Nancy.
Yes, thank you.
I don't read every email, so that's pretty good.
That's pretty good. All right. Okay. We have, who else do we have on the phone? Mark Massaro, right? Where's Mark? Mark still here? Did I lose him?
He was on earlier.
Yeah. I feel bad. I always make poor Mark wait till the end, but sounds like Eversource did a good job with the one outage, so hopefully no more. And it sounds like you're all satisfied with that response at this point. Mr. Long, anything from the police commission or from your vantage point, sir? I think you're on mute, Mike. You all set? Good? Okay. We had a good... Okay. All right, thanks, Mike. We had a good reminder from Chief Baldus in our pop-up chat to make sure you're shoveling your hydrants. There is an ordinance that requires you to do so. If you need help, call Chris Peterson, call myself, knock on the 12-year-old's door next door. They're not at school. I'm sure somebody would help you do that. But let's make sure that all of our friends and neighbors stay safe and that we're shoveling out those hydrants, especially while the snow is light and fluffy and fun, before it gets mashed down and then you need an ice pick to get things out. Did I miss anybody this morning? Other than debating whether the Red Sox, your Yankees, or your team, I think we have settled everything for this morning. Happy Hanukkah to those that celebrate. Merry Christmas to those, and happy holidays to all of you. We will see you in January. I hope that you and your families get some time off here. I know that you folks don't often get to enjoy the holidays like the rest of us because you're generally working, but we do appreciate that. I hope everybody stays safe and has a happy New Year. Talk to you all. We'll talk to you all next year.
You as well.
Bye, guys.
Happy holidays, everybody.
Take care.